great resource, and we hope that we'll get continued funding to conduct this study. The Department of Defense has been very generous in this realm. So ideally there'd be a national registry, and PAN, the Parkinson's Action Network, was very active in trying to get the Centers for Disease Control, the CDC, to implement a national Parkinson's registry, but the political climate is not very conducive to getting much done. So they've put this on hold, but ideally would be the best way for us to continue studying the risk factors for Parkinson's disease. So I want to acknowledge my coworkers at the Parkinson's Institute. Dr. Carolyn Tanner is the chair of our department, and Dr. Bill Langston is the president of the Parkinson's Institute. He's the discoverer of MPTP, as I mentioned, and a good friend of Dr. Wooten. And I invite all of you, if you're out in Northern California, to stop by. We're about 30 miles south of San Francisco. You can go to the Napa Valley. You can enjoy yourself and stop by. And I also want to thank all of our research supporters. So the NIH, call your congresspeople, ask them to increase funding for Parkinson's research. NIEHS, that's the National Institute for Environmental Health Science. The Neurotoxin Exposure Treatment Program of the Department of Defense. Parkinson's Unity Walk, the Michael J. Fox Foundation, the Parkinson's Disease Foundation. There are more and more. They're not even all up here. So this work is very expensive and very important. So I want to thank you all for staying awake. I'm amazed. And I don't know if I have time for questions.
Any questions?
Yeah, maybe, I don't know if we can hear, can maybe the lavalier?
My question is this: when you go out and study these various possible environmental causes like pesticides and the solvents and this sort of thing, how do you deal with the issue of the intensity of the exposure? I mean, an exposure
Right.
per se doesn't tell you much.
Sure.
Do you have enough data to know that the intensity of the exposure is about the same across the sample?
Right. It's very difficult to measure that. So the question is, how do we determine the intensity of exposure, the degree of exposure, for example, to pesticides or solvents that someone may have had? It's very difficult, especially, as I said, because a lot of these exposures that we're actually interested in occurred 30 or 40 years ago. So it's coarse, I would say. It's imprecise. Now, some of these compounds, like the organic chlorine, pesticides, and PCBs, those persist, so we can actually measure those in tissue. The other compounds we have to estimate based on the types of jobs that people did, the tasks they performed. With the farmers, it's easier because they know what they were applying. Sure. Is there evidence in your body if you've been exposed? For most of these exposures, no. But for some of the toxins that are very persistent, if they're persistent in the environment, they're probably persistent in your body. So, for example, in our study in Alaska, we are measuring these PCB levels in blood from our study participants. Yes, sir.
My concern is mainly we buy fruit and vegetables grown in many parts of the world. A lot of them have no regular, the growers have no regulation
Right.
as to what they can and cannot use. As a consumer of those fruits and vegetables, do you have any recommendations on what we can do to wash, clean, or cleanse the product before we consume it?
So the question is, we don't know what pesticides are on our fruits and vegetables, many of which come from outside the country where there's less pesticide regulation. What can we do about it? I would just recommend washing everything that you eat. You can use a mild detergent to take off some of the residues. They use waxes and things to make the fruit attractive. That actually make it more difficult to remove any substances that might be attached. But personally, I advocate organic produce. But the downside to organic produce is it's susceptible to pests, and the yield can be lower. So natural pesticides are far preferable. Natural meaning biological pesticides, such as insects that might eat the pests. Yeah.
Am I understanding correctly that when you say, okay, if there is an environmental situation, that normally you have to have another factor, not just environmental?
So the question is an environmental exposure sufficient to cause Parkinson's, or do other factors need to be involved? The vast majority of Parkinson's is not going to be due to a single environmental factor. We know that because there are very few what are called clusters, disease clusters out there, meaning areas where a whole group of people develop Parkinson's disease who live in a particular area or do a particular job or exposed to a particular substance. There was this one observation in the TCE group, but that was a group of just a few people. So that implies that a single environmental exposure is probably not enough to cause Parkinson's disease, that you either need multiple environmental exposures or environmental and genetic factors interacting. And they don't have to interact at the same, they don't have to occur at the same point in time either. So it may be a head injury when you're 15, and then you've got a very gradual process that's ongoing biologically, and then you get exposed to TCE or paraquat, and that accelerates it. As I mentioned, probably 5 times as many people have smoldering Parkinson's disease that never shows up. So it may be that some or several of those exposures is enough to increase the rate at which it progresses, so it becomes clinically apparent.
On your pesticides, I worked with pesticides for over 45 years, and I don't have Parkinson's. Is it possible that it's transferred to my wife because of what you're working with to cause her to have Parkinson's?
So could someone who works with a toxin bring it home to their family? The answer is probably that's possible. That's actually, for the solvents, that's not, I don't know about Parkinson's being transferable that way, but TCE and PERC, those dry cleaning solvents, they persist, and people who work with those compounds do bring them home to their families. So it's unlikely because, of course, the dose of exposure is going to be highest in the person who's working directly with the compound. But it's possible.
Because I've worked with everyone you listed, plus some that you don't even talk about.
Oh, no, I can't talk about those. Sir.
I worked in a small town, paper mill town, back in the years. There was maybe 1,000 people in the entire town that were the age of people that get Parkinson. And I know of over 50 people in that 1,000 who had Parkinson. And that's the only exposure I know of that had. Myself and 4 of my next-door neighbors all had over a dozen, there were 30 people in this particular neighborhood had it. And I've never seen anything other than paper mill exposure that could have caused it.
Mm-hmm.
Have you ever looked at paper mill?
We have paper mills. Were This association has been considered, and is still being considered as a possible relationship with Parkinson's disease. And what you're talking about is a great reason why we need Parkinson's disease registries, so that we assume that there aren't clusters like this out there, but we don't know, because no one's ever measured every case of Parkinson's disease that's occurring. So it's certainly possible that there's a relationship there. It's hard to say. What we would, again, you need replication. So if we observe this in your town, and we observed it in 3 or 4 other towns around paper mills, that would be strong evidence that there's a true relationship there. So that's a very good reason why we need registries. One more.
Do you have any intent to look at things that FDA has already approved, like artificial sweeteners or aspartame, Gulf syndrome, and that type of thing?
Well, all of these compounds were approved. So some of this work leads to changes in the allowability of use of these compounds. So TCE is now being phased out. Some of these other compounds, we're looking constantly. When we conduct these studies, we ask every question imaginable. So we do take dietary histories, lifetime occupational histories, hobbies. So we do try to look at these, but it's difficult, because diet when? 5 years ago, 40 years ago, and it's very difficult to get a history of someone's diet 40 years ago. But we do take those, and there have been some dietary associations, so we do continue to look. Oh, so there's some pamphlets up here if anyone's interested, not too many, but from the Parkinson's Institute, talking about some of the work that we do. And if you're interested, they're up front here. And, thank you.